Good afternoon. I want to thank everyone for being here today. We want to give you the latest update on where we are with COVID-19. Just a couple of hours ago, new guidelines were announced by the White House and federal health officials. I will be working with Dr. Kara Christ and the Arizona Department of Health Services to ensure Arizona complies and updates our guidance to reflect these new recommendations. We will be working with county health officials, community leaders, and the private sector to implement these guidelines and to spread the word. We've already updated our guidance based on the CDC recommendation that large events and mass gatherings be canceled. Many already have, and the private sector and community organizations continue to be responsible partners in this effort. On these decisions, we aren't guessing. My decisions are being guided by data, facts, and science in consultation with subject matter experts. When the CDC makes new recommendations, Arizona will apply its guidance. Yesterday, in coordination with Superintendent of Public Instruction, Kathy Hoffman, we announced a 2-week school closure to address staffing shortages and prioritize Arizona children. Superintendent Hoffman is here today. I'm grateful for her partnership and her leadership. We worked together through the weekend, and she's been an incredible advocate for Arizona schools, teachers, and students. Arizona is lucky to have her steady leadership during this crisis. As we made clear yesterday, it's important for families and parents to know that while this will address operational issues, closing schools will not stop the spread of COVID-19. The safest place for children at this time is at home. They should not be cared for by elderly adults or those with underlying health conditions. For those who can't stay home, we're grateful for the partnership of so many nonprofits and other community members and the faith-based organizations who are stepping up to assist during this difficult time for these families in need. We have formed partnerships with the Boys and Girls Club, the YMCA, and more to come. I'm going to hand it over to Superintendent Hoffman to talk more about her efforts with our schools and education community. Superintendent Hoffman.
Thank you, Governor Ducey. I also appreciate your partnership and your leadership.
Thank you.
Good afternoon. Today, I'd like to provide an update to families and educators across the state regarding statewide school closures for all public and private preschool through 12th grade schools. I want to first recognize that these are unprecedented circumstances and that they place a heavy burden on every Arizonan. Our state leaders are committed to supporting our kids, families, and school communities through this difficult time. Together, we will get through this. I want to highlight a few resources educators and schools can find on our website that will be continually updated as information is changing. The first, a top concern of mine, is guidance related to school meals. The Arizona Department of Education's Health and Nutrition Services team is working with district and charter leaders on steps they can take to ensure schools who qualify offer food in a similar manner as the summer food service programs. While our department works to provide a comprehensive list of schools offering meal service for all children under 18 years of age, please contact your local school officials to inquire about programs offered in your area. I know that many educators, parents, and students are wondering about statewide testing and the potential for makeup days in the summer. While we continue to take this one day at a time, we have been working with assessment vendors to extend the testing window as needed. We are also in communication with our federal partners in the event we need to secure a waiver for statewide testing. In the coming days and weeks, we will provide additional guidance to schools around testing, instructional time, and other critical matters. I also want to speak directly to educators and school staff. Each one of you has stepped up to serve Arizona's children, and for that, you will forever have my gratitude. Now more than ever, Arizona's children and families need you. Today, we are calling on school leaders to provide safe and responsible ways for teachers and other school staff to continue serving our students in creative ways. I urge schools to be as flexible as possible during this time, and I want to assure you that the Arizona Department of Education has no interest in being punitive in any way towards schools, teachers, or students. I know that many logistical questions remain to be answered. Please know that my team, alongside Governor Ducey and Dr. Christ, are committed to keeping you as up-to-date as possible. Please visit our website at azed.gov for a running list of resources for families and guidance for school leaders. Finally, I'd like to take this opportunity to remind all of us that in these difficult times, Arizona students are looking for comfort, guidance, and reassurance that everything's going to be okay. I encourage every adult to approach this scary situation with kindness and compassion towards others. It's our job to set an example of patience and goodwill. Arizona has proven to be a strong, resilient community, and together we will meet the needs of our families and our children. Thank you.
Thank you, Superintendent Hoffman. Next, we are working with our Secretary of State, Katie Hobbs, and county election officials to adjust for the presidential preference election. I'm grateful to have Secretary Hobbs here, and her partnership and leadership have been very important in ensuring that democracy goes on. Through DEMA and ADOT, we've made sure that election officials have the equipment and support they need for the polling places to function tomorrow. Our election leaders have been working overtime to ensure that voting is safe. Let's hear more from Secretary Hobbs on her work to prepare for tomorrow. Secretary Hobbs?
Thank you, Governor Ducey, and thank you also for your partnership, Dr. Christ. We understand the apprehension that voters have right now. My office has been in consultation with election officials across the state, health experts, and leaders from the Democratic Party who agree that the election should move forward tomorrow. This decision was not made lightly, and what it all comes down to is that we have no guarantee that there will be a safer time to hold this election in the near future, and elections do not end on Election Day. There are thousands of workers in communities across the state that must continue the job of counting the ballots in the days following the election. The longer we wait, the more difficult and dangerous this will become. My message to voters is stay informed and make a decision that is right for you. Some counties are offering emergency voting today, curbside voting at Election Day voting locations, and ballot drop-off locations, including drive-up drop boxes. Contact your county election officials to learn more about options available in your county. Our office is constantly monitoring the situation and will quickly communicate to the public any new developments. Since some voting sites in the state have been relocated or consolidated, all in-person voters and those dropping off early ballots should verify voting site information with their county election officials. Contact information for those trusted sources and additional information is available at arizona.vote. Arizona.vote is also where voters can find the most current updates related to recommendations and guidelines. As a reminder, only the Democratic Party is participating in this presidential preference election, so only registered Democrats who are registered by the deadline of February 18th, 2020 are going to be able to participate. Our democracy has risen to challenges in the past, and it must continue to do so.
Thank you very much, Secretary Hobbs. Now to the work of our health professionals. As of 9 a.m. this morning, Arizona has 18 confirmed COVID-19 cases. Our health professionals, led by Dr. Kara Christ, have been working around the clock to address the disease and provide additional testing. Today, both Banner Health and Sonora Quest opened their first patient-friendly testing site to increase the speed and availability of testing, with more on the way. More partners like LabCorp, TGen, and Mayo Clinic are also conducting testing for patients in Arizona. I met with all of these labs earlier today for a full briefing on their work. We're grateful that the private sector is stepping up during a time of need and providing additional options for testing for Arizonans. Our team will continue to explore ways that additional testing options are made available across the state. At this time, I'm going to let Dr. Kara Christ share some more on this topic. Dr. Christ.
Thank you, Governor Ducey, for your leadership and making the health and safety of our communities the top priority of your administration. I'm grateful for the partnership we have in working with DEMA Deputy Director Wendy Smith-Reeve and community stakeholders, including Superintendent Kathy Hoffman, Secretary of State Katie Hobbs, and private sector lab partners. My team has been working nonstop in response to COVID-19 to ensure we keep our communities and families safe. We are constantly monitoring local, national, and global activities so that we can make data-driven decisions that protect our communities while having as minimal of an impact on Arizonans' daily lives as possible. So I want to provide the latest information about the spread of COVID-19 in Arizona. To date, we have 18 cases. There are 8 cases in Maricopa County, 5 cases in Pinal County, 1 case in Graham County, and 4 cases in Pima County. We have community spread of COVID-19 in Arizona, and we are expecting more cases. There is a heightened level of risk of COVID-19 now that we have community spread. Our goal is to mitigate the spread of the disease and lessen the impact on people at the highest risk for serious complications. People at highest risk for COVID-19 are older adults and people with serious medical conditions like heart disease, diabetes, or lung disease. My team has been working tirelessly to ensure Arizona complies with the new guidance provided by federal officials earlier today. Federal officials are now advising the following, and we're working to review any updated guidance from the Centers for Disease Control and Prevention. If someone in your household has tested positive for COVID-19, keep the entire household at home. Do not go to work, do not go to school, and contact your medical provider. Employers should develop protocols to work from home when possible. For those workers in our healthcare industry and pharmaceutical and food supply, your continued service is very important. We need this community to maintain their normal work schedule and follow CDC guidance to protect your health while you are at work. Everyone should avoid social gatherings in groups of more than 10 people. That includes avoiding eating or drinking at bars and restaurants, using drive-through or pickup options instead. And they recommended avoiding discretionary travel, shopping trips, and social visits. We are currently reviewing this as this comes down, and we'll develop Arizona guidance to go with that. We encourage people, particularly high-risk individuals, to have supplies on hand, such as extra prescription medications, over-the-counter medications, and other household items and groceries. Take everyday precautions, such as avoiding people who are sick, washing your hands often, and cleaning and disinfecting those high-touch areas in your house, like doorknobs, light switches, toilets, faucets, and phones. Stay away from crowds, and have a plan if you get sick to call your healthcare provider and identify who else can care for you if your caregiver gets ill. There are a lot of questions about getting tested for COVID-19, and I want to provide you with the latest information about testing in Arizona. There are now several private laboratories that can test for COVID-19. These labs include LabCorp, Quest or Sonora Quest, Arup, Mayo Clinic, and TGen. I want to thank each of these labs for working to get private testing implemented so we can test more people in Arizona. People should work with their healthcare provider if they are symptomatic, and all tests must be ordered by a healthcare provider. Please call ahead before going to see your provider so that they can give you instructions on how to keep other patients safe. In collaboration with Banner, we are planning to open collection sites. We appreciate Banner leaning forward to provide this valuable service to Arizonans. More sites and more information will be available this week, and we will notify the public of the locations of those sites and where those services are available. We know that other healthcare and laboratory partners are in the beginning stages of implementing screening locations. We're working with other sites to continue standing up additional alternate screening locations throughout the state. In order to provide support for this, I have issued a standing order that will allow symptomatic Arizonans to receive screening at these sites. And the Arizona State Public Health Laboratory will also continue to test those high priority samples that are sent from our county public health partners. As of today, the Arizona State Public Health Lab has tested 200 people. The lab has ruled out 125 people, and there are 63 samples pending. You may notice that the data on our website has recently been updated related to this. While positive cases across all labs will be reported on our website, more detailed information about the number of people tested, pending, and ruled out is only available at this time from our state public health lab. Of the 18 cases we have in Arizona, 12 have been confirmed by the state public health lab, and 6 have been confirmed by private labs. This information is updated on our website every morning at 9 a.m. To stop the spread of COVID-19 and protect our most vulnerable community members, we ask everyone to routinely implement infection prevention practices. And I know you've heard this from me before, but it bears repeating. The best way to prevent the spread of respiratory viruses are to do the following. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then immediately throw that tissue in the trash. Clean and disinfect frequently touched objects and surfaces. If you need to see a healthcare provider, it's a good option to consider telemedicine. In closing, I urge everyone to find reputable sources for information about COVID-19. We have a dedicated website that is updated daily, and you can find the most up-to-date information about the disease at azhealth.gov. The CDC also provides current updates about the latest information, and we are partnering with the Arizona Poison Control System to offer a COVID-19 hotline for the public and for medical providers who have questions. This hotline can be contacted at 1-844-542-8201. We will continue to provide the public with the most up-to-date information and advice on how to keep yourself and your loved ones safe. But now I'd like to introduce Chief Clinical Officer, Dr. Marjorie Bessel from Banner Health.
Thank you. As the largest employer in the state of Arizona, Banner Health is positioned to help all of those that reside in Arizona to get through this event in the best and healthiest way possible. There are a number of things that all of you can do to assist all of this, in addition to the tips that you heard from Dr. Christ. At Banner Health, we are partnering very closely with Dr. Christ and her entire team. We've been working with public health since the beginning of this event to make sure that we are providing timely and evidence-based guidelines for the care of those that reside in our state. We follow CDC guidelines throughout every event, and in this event, that is no exception to our usual and customary processes. Like you heard from Dr. Christ, we continue to regularly look at the CDC site and update our processes to remain within guidelines that are best positioned for us to take the best care of those that reside in the state of Arizona. We are happy to partner with both the state as well as other federal resources to provide testing to the state of Arizona. As you heard from Dr. Christ, we will be having more information about that and make that publicly available later this week when we're ready to do so. In the meantime, there are some things that you can do out in the community that can absolutely assist us as the largest healthcare provider in the state be positioned to be able to continue to care for those that reside in our state. As you heard from Dr. Christ, please follow social distancing and other great hygiene around hand hygiene and respiratory etiquette to keep yourself as safe as possible. We have already implored for those that work for us to not come to work ill. It is incredibly important at this time to not go to the workplace if you are feeling ill. We have daily reminders and electronic checking mechanisms for our employees to make sure that they are not coming to work ill nor staying in the workplace ill. This will help us at Banner Health continue to keep our healthcare workers healthy so they can be here to serve you. In addition to that, for those that feel that they might have symptoms and feel like they might need medical care, we ask for you to call ahead of time. If you have a primary care physician, please call ahead of time. If you have access to other points of care, please call ahead of time. Work with your healthcare provider to determine whether or not you need to come on site for assessment and then possible testing. If you must come to the site for assessment or possible testing, we ask you to mask yourself immediately upon arrival. Masking yourself if you are a symptomatic individual who might ultimately then turn out to be positive for COVID-19 will help prevent the spread of the disease to our healthcare workers. Our healthcare workers' safety is of primary importance so that they can maintain being at work and able to take care of those of you who might need their care. If you mask yourself immediately upon arrival, the spread of disease to our healthcare workers will be minimized. At all of our entrance sites, there is signage to remind you to put a mask on if you are symptomatic, as well as masks available for you to put on. In addition to that, I would like to close by saying that our partnership with the Department of Health Services, those in the state and those at the federal level, is of very significance to the Banner Health system. We look forward to continuing to follow the CDC guidelines, update them frequently, put our processes into place to be in compliance with those guidelines. If you have additional questions, you can go to our bannerhealth.com website, which will help guide you to find information about the symptoms, possible treatment options, and ultimately collection sites that we will be announcing later this week. Thank you.
I'm Dr. Jeffrey Trent. I'm the President and Research Director of TGen, and I want to thank Governor Ducey, the leadership of Dr. Christ for their effort and all of us at Arizona getting access to testing for the coronavirus. I'm joined in the room today by Dr. David Engenthaler, the former state epidemiologist, the head of TGen North, which is our division in Flagstaff that is set up in 6 weeks for FDA approval and CLIA testing our specific test around COVID-19. That gets joined to all of the other partnering testing groups mentioned today. We've been fortunate with our partner, the Arizona Department of Health Services, to participate as well beginning last week in some population screening, something that we believe is critical as well going forward. That has been joined by funding from nonprofits, Flynn Foundation, Piper, the NARBA Institute as well. Last week and this week we've been testing at the level of about 200 capacity per day. Next week by the end of next week, that'll change to about 1,000 a day. And again, those are in line with the other groups that are working on this today. This is, of course, as needed and in direct support of the state's response. I want to thank again the governor for his leadership, and thank you very much.
Thank you, doctors, and thank you to Banner and TGen as well for being here. As you can see, we're working on several fronts to address the impact of COVID-19 on Arizona. And this situation is constantly evolving, as we've seen just this afternoon. We're focused on this 24/7. We've got a great team here at DHS and with all of our partners. I hope you can also see that this is bipartisan. It's actually nonpartisan. We're relying on the medical experts, both here in Arizona, at the CDC, and at the NIH. We're going to continue to be guided by the facts. We're going to be transparent, we're going to be timely, and we're going to act with urgency. What we've seen is that Arizonans have acted responsibly through this, and they continue to act responsibly. Now, tomorrow is St. Patrick's Day. If you're thinking of going out to a crowded bar to celebrate, our advice is don't. Social distancing or personal distancing is one of the greatest measures you can take to stay safe, and that's hard to do in a crowded bar. We appreciate the work being done by the Arizona media to get the facts out and the latest information to the public. It's really important, and we couldn't do it without your work and professionalism. We also need people to donate blood. Our food banks need your help. I encourage Arizonans to contact the Red Cross and their local food banks to help on these fronts. And I especially want to thank those who are holding our communities and state together right now. Community leaders, nonprofits, our faith-based community, law enforcement officials, doctors, nurses, and our grocery store workers who have been working around the clock to meet demand. And finally, I want to reassure Arizonans, we will get through this, and we're going to get through this together. There's a lot of work to do, and as you can see today, we have people from across the state dedicated to getting this done together in a partnership. It's going to take all of us. With that, we'll open it up for some questions.
Let's start over here, Dennis. Yeah, you're talking about the elections moving forward, and you're urging people not to go out on St. Patty's Day. Yet, thousands of people could be going out to the polls tomorrow. Why not suspend this and extend this like your home state of Ohio has chosen to do? How can that be safe? And you worry that this may disenfranchise voters who are scared to come out and vote tomorrow?
Well, first I want to say we are putting out guidance on best practices. This practice of social distancing or personal distancing is important. And I'm going to turn it over to the secretary, but I think she said it well, that we have no guarantee that there will be a time in the future when it will be safer than tomorrow, and that democracy must go on.
Thank you. And I think it's important to keep in mind about the social distancing guidelines that they apply to social situations. And our intent at polling places tomorrow is to get people in and out. There's one thing on the ballot and one thing only. And the polling place workers, we've been working across the state to make sure that they have what they need to implement the guidelines, and that they are going to work with if there's people in line, to social distance and make sure that those things are being maintained.
Maybe some of the health experts could weigh in and ask if this would be a high-risk situation, walking into rooms where people are touching things. I mean, would that be a high-risk area?
So we have been providing guidance and talking about having hand sanitizer or hand washing stations at the polling places so people can take that personal protective step. We've also talked about trying to social distance people while they were in line to make sure that there's more space in between them. They are offering other ballot options for drop-off so that people don't have to go in, and then just making sure that they are wiping down and disinfecting the areas at a certain cadence. So we have been providing technical guidance on that.
Other questions? Krista?
Yeah, my question's for Dr. Christ. You mentioned the screening locations. If somebody goes to a screening location, can they be referred to get tested? And does the health department now have the test to kind of meet that if that demand does jump?
So these test collection sites are actually going to be done with our partners. So for instance, the one that we're partnering with Banner Health on, that would go through Sonora Quest Laboratories, because we are trying to keep the capacity in the commercial laboratories. So it's going to depend on each individual entity and how they're running their alternate testing site. Some will be for their specific patients if you're dealing with a specific healthcare provider. Others are going to open it up, and then that's when they'll be able to show up, look at a consent form that they will attest to the fact that they have symptoms, that they will isolate themselves until they get their diagnosis, and then they will be tested under my standing order.
Hey, Nicole and then JJ.
Dr. Chris, this will probably go to you. Why is Arizona still using such strict guidelines for the state lab to test? We know Colorado has tested 758, New Mexico 583. Why does Arizona still have such strict guidelines?
So we are sticking with those 3 tiers of testing at the Arizona State Lab. We are looking potentially at expanding them, but since we've got such support from our commercial laboratories, we believe that that will be able to pick that up.
But the laboratories, most of them, it has like a 5-day turnaround. The state lab can get them out quicker, right?
It just depends. They've got the same turnaround that we do, but they have shipping and handling. So it depends on when our state lab gets our specimen to determine whether it's a same day, next day, or the day after turnaround.
And last question, the CDC updated their guidelines a week ago for state labs, so when will Arizona update theirs to the CDC recommendation?
So we are working with our partners on that. It depends on the availability of the testing reagents and us, because we are that high risk population. That's what we are testing. So we want to make sure we've got the capacity to test those while our commercial labs are testing the population.
JJ, question for Dr. Chris. The DHS website does not have coronavirus information in Spanish. Why is that, and what are you guys doing to communicate with people who speak predominantly Spanish?
We are working on trying to get it translated to Spanish. This has been a rapidly evolving situation, and so things update almost daily. We are working on getting a lot of our hard materials translated into Spanish and working on getting Spanish in our social media, and then working on getting that webpage.
Are you worried that delay will lead to a greater spread in the community than otherwise necessary?
It's just, there's a lot to keep up with, and so we are translating as quickly as we can.
Okay, and then can you talk at all about, and maybe the representative from Banner Health too, could talk about hospital bed capacity as cases ramp up. How much flex is there in the capacity and what's being done in this span to bring more people to that?
Yeah, absolutely. So we are working with our healthcare partners to expand potential bed availability and looking at the ICU capacity around the state. With the declaration, the National Emergency Declaration issued by President Trump, that opens up certain authorities in addition to the public health declaration of emergency that Governor Ducey, that allows us to waive specific licensing rules so that we can increase capacity and ensure that we can get patients into alternate sites as needed. Was there anything else, Dr. Bessel?
As we have learned from other countries and other states, one of the most scarce resources that can emerge out of this type of event is our staffing. So protecting and keeping our healthcare workers safe is of primary importance. I want to reiterate my comments that I made earlier, because all of you that are out there can help us keep our healthcare workers safe, both at Banner Health as well as the other healthcare organizations within the state. If you feel that you are sick and you might need to be evaluated and therefore tested, we ask that you please call ahead of time. That way we can help triage you appropriately, and perhaps you don't need to come on site for ongoing care or direction of care. If you do come on site, please immediately mask yourself if you're symptomatic so that we reduce the risk of spread to our healthcare workers. By taking those steps, we can absolutely keep our healthcare workers safer and more available to take care of those who are going to need us as the COVID-19 situation continues to emerge. Thank you.
Katie, you had a question, then we'll go over here.
Real quick, Dr. Chris, what guidance do you have for gyms? Should they be closing down at this point? Are there some sort of sanitation procedures they could follow, gymnasium?
So we are encouraging right now that gatherings over 50 be limited. With a gym, it is possible to social distance, so that would be on the individual to take a look at what are their current health risks and what are their risks for serious complication. But then also, if the gym that they go to, can they social distance? Is there things to wipe the bars down? Can you stay away from potentially other sick individuals? And again, we're reviewing that new CDC guidance to see how that will impact businesses like gyms and restaurants.
Stephanie?
These test collection sites, are people going to need a doctor's order to go to them? And is it ever going to be practical to test everybody in Arizona who has symptoms?
So for symptomatic patients, they won't need to have specifically an order from their own physician because we've issued a statewide standing order. So if, for example, the testing collection sites that Banner will be standing up, they are using my standing order, so I am the ordering physician. So they'll have to attest that they have symptoms, but we are looking at expanding that with additional healthcare partners and looking at how we increase that capability.
But they have to fit into one of those three categories?
No, so this would be anybody who believes, yes, that's a wider.
So like if I have symptoms, I could go?
If you're coughing, fever, shortness of breath, you could, yes, you could use yourself.
To everybody in
Yes.
That's a big difference.
Yes, so this will expand the availability to more Arizonans.
Mark, you have a question?
Yeah, this, Dr. Chris, for you, and I do have one for the superintendent. Dr. Chris, has there been any consideration, if you get slammed with patients, to reopen any of the St. Luke's hospitals here in the valley, the one in Tempe, the one in Phoenix that have been closed recently, to supply the bed space? I don't know if they still are equipped or what over there, but has there been any thought to that?
So yes, I believe our local public health partners are working with to identify if St. Luke's would be a good site for an alternate care setting. As well, we've had other physicians who have identified a potential location where alternate sites could be posted to. So we are looking at that around the state.
And Superintendent, today the President mentioned that this social distancing scenario that we now find ourselves in could last through August. So are you now considering the possibility that the school year might not end until technically the start of the next school year? And what does that mean for you?
Well, as the governor mentioned, the situation is constantly evolving, minute to minute, hour to hour, as you all know. And so the way we're planning is we just had a stakeholder meeting with education leaders, and we said, what do we need to address today? What are the most urgent, pressing matters for schools today? What does that look like if we're closed for 2 weeks? And what does that look like if we're closed for the rest of the school year? So we are thinking about it in the most immediate, short-term, and long-term way.
No solutions yet?
Well,
Thoughts?
depends on which issue. So for example, for meals, we already have solutions rolling out because meals were a very high concern. One issue that's another high concern is teacher pay or staff pay for our hourly workers. That's an issue that we're partnering with the governor's office and the legislature on, and we're hoping to have recommendations out as early as today.
Go to 10 and then Howie.
Superintendent, what is the worst case scenario if, say, the CDC recommends closure of 20 weeks? As far as schools go, would we be able to get a waiver for students not have to make days out? What is the worst case scenario plan?
Well, we're still working on the plan, but if we get to that point where we're closed for the rest of the school year, then we will be working with the federal government and on things like testing waivers and not having to make up school days. Those are some of the various solutions that we're looking at. And we'll continue to be in close communication with our school leaders on what works best for their communities. We're also grateful for the partnership of different entities and organizations for providing online resources that previously cost schools money, but now they're offering for free.
And Governor Ducey, you're telling people not to go out and party tomorrow. Under what scenario would you recommend the closure of bars and restaurants and businesses?
What we're doing is making every decision that we can that we believe is in the best interest of public health in the state of Arizona. We're doing it with guidance from the Centers for Disease Control and Prevention and the National Institute of Health as they update their guidance. Those discussions, along with the discussions, I was able to meet with doctors today and providers today. Those inform our decisions, and we're going to continue to make decisions as this unfolds over the course of time to protect public health in the state of Arizona. So we're not at that point, but we do think that the guidance that is out there, and I would encourage everyone to go to azhealth.gov so they can see the guidance specific for the state and citizens of Arizona.
Would it be safe to say once the CDC recommends closures of...
We will be following CDC guidance.
Go to Howie and then behind him and then Ryan.
Governor, a couple of things. Number one, you talked about how responsible Arizonans have been. I do all the family shopping. Not only are we out of sanitizer and toilet paper, but cat food and everything else. You know, how responsible are people when they're hoarding things? You cannot find canned soup. You can't find cat food. You can't find paper towels. How do we prevent hoarding?
Dr. Christ and I are accessible every day. We're communicating what the situation is in Arizona, what the facts are, and what is necessary. With all that said, the fear that's out there is very real. I think you've heard from federal authorities, Health and Human Services, and I want to say it from the podium as well. The supply chain for Arizona and for the United States of America will be protected. We are in coordination and communication with the leaders of our largest grocery chains, and they will be replenished. So I would encourage people to buy what they need. So that their neighbor can have toilet paper and necessary things for their food pantry as well. It was Dr. Christ that mentioned the situation of prescription drugs for someone with underlying health conditions. That would be maybe one situation where someone would stock up. In these other situations, I have high confidence in our grocery stores, in our manufacturers, that they will be able to more than keep up, but we've got to buy on a consistent basis.
One related thing also came out of the Trump press conference about flexibility, things like unemployment. Right now, you have to be laid off, out actively looking for work, things like that. We have a lot of people whose businesses have closed, who have virus. We don't want them out looking for work. What do you plan to do? What do you plan to ask the legislature to do as far as unemployment?
Well, this is an evolving situation. We understand that the social safety net is going to be stretched, and we're going to be part of the people leading that stretching of how we can help people that have lost their job through whatever's going to happen as a result of COVID-19 and some of the guidance and decisions that will have to be made around that. But that's evolving. We're going to work with the legislature and the federal government to advocate on behalf of all Arizonans.
We'll come here, then we'll wrap up with Brian.
This question is for Ducey. So I want to touch back on the social distancing about the guidelines. So you say you're following CDC guidelines, but then you have states like Massachusetts who have banned going to restaurants and going to bars. And as you mentioned again, tomorrow's such a huge day for some people, especially college students. Do you think that maybe you will try to ban that to stop the spread of COVID-19?
Our circumstances in Arizona today are different. It's a big country with 320 million people. I'm focusing every day on what's the best decision for the state of Arizona. Along the way, we've made emergency declarations. We've put out executive orders. We've made the decision to shut schools. As things are necessary or needed, as we have the data, the facts and the science, we'll make decisions. This is where we are today, and it will change.
Right. Dr. Chris, can you tell us what those tests are going to cost when those stations open later this week?
So I may turn that over to our partners. It's going to depend right now, based on your insurance, what type of insurance you have. And we do know that they've waived copays and that it should be considered an out-of-network, like if it is out-of-network, it should be covered by your insurance carrier. For those that are identified as high risk by public health, those tests are free here. But we're continuing to get more information on the pricing because we don't know if the state were to step in, how much that would be. So.
That raises an interesting question. If I just quickly follow Ryan's question. I understand the waiving the copays, and that's great if people have insurance on Medicare, that's fine. There are people in Arizona, there are 1 million people without insurance, without access, without anything else. What about them?
So we are still exploring that cost. We have been told by the federal government that the tests are free, so we are looking into what mechanisms and how we do that. So we're continuously trying to identify that.
Can we just clarify, we keep talking about bars. What about movie theaters, parks, malls, places where people would go? Are we recommending scaling back on that? Even public places like a court?
So what we're recommending on right now with the guidance that was released yesterday is mass gatherings over 50 people. So that would include potentially malls, festivals, parades, concerts, those types of things. As we're looking into what the CDC recommended today, we'll be making more more tweaking to that guidance to identify, are there ways to social distance in restaurants? Italy had some interesting social distancing there. So how do we establish that? But we're still looking at that guidance.
So why not just shut them down now?
There are still possibilities that they could stay in business because you still can do drive-through, you can do pickup. There are ways to social distance without shutting down like the restaurants.